Hi, I'm Alex. I'm the co-founder and CEO of Navi Medical Technologies. Some of the hurdles that we face as sort of a medtech startup here in Australia are that building a medical device for a European or a US market while being located in Australia can be tricky. Some of the other areas that are really tricky are around product development, manufacturing, and actually doing some clinical trials.
I'm Christiane Theda. I'm a newborn specialist at the Royal Women's Hospital in Melbourne. It is a long way from an idea, even if it's a very good idea. Most of the time people underestimate the effort and the investment it takes because all the work and the development work needs to be done to the highest quality standards to actually find the team to do it and then go through all the stages that are required. So there's a relatively high cost in the development.
The funding that we got through Breakthrough Victoria was really helpful for a number of reasons. Firstly, we used that to grow our team. So we added some capabilities in regulatory and quality and also in some clinical research. The second area that it was really useful for was in completing some of the product development work that was already underway. So that's now coming to a close. And then the third area that funding will be really useful is in doing some clinical research to gather some data that we can then use in a future regulatory submission.
We've been really fortunate that the Royal Women's Hospital has supported us in several trials now, where we have basically explored the performance of this technique versus the gold standard. We kind of expected it to work, and we know the physiology says it should work, but of course you put a lot of work into it, and then actually seeing the data that it works. A little bit my reputation on the line as well, so I was delighted that it worked as well as it did. Now we're progressing to really provide the data to the regulatory agencies that this device is ready for prime time. It's ready to be used as a routine device in clinical units all over the world.
My name is Xingyu Sheng. I'm the co-founder and chief operating officer at Navi. Just last year we had a physical prototype that we were able to share to clinicians for the very first time. They were able to have a play around with it. We actually got some really good feedback and people were really excited, and I can't count the number of times where the clinicians said that they couldn't wait to have this in their hands and to use it in their practice.
My name is Navi. I'm the Chief Technology Officer and also one of the co-founders at Navi. NeoNav is a big system. It has multi-engineering disciplines involved in it. I think we've finished the design, both on the software and the hardware. At the moment, it's all about documentation, to be honest. It's just like documenting every little crook and nook that went into the design and testing.
I'm so proud of our team for everything that we've done. From day one, I think the reason that I felt comfortable working in a startup was because I really enjoyed the people that I was working with. And I'm really proud to say that everyone's still here.
It was super exciting. I mean, it was something that we've built up from scratch, so it was something that meant a lot to us. Definitely wouldn't trade it for anything else in the world. I'm really glad I picked this pathway and I'm working with some of the best people that I know.